Good afternoon, viewers and participants in this webinar being hosted by the Cipriani College of Labor and Cooperative Studies. We do apologize for the slightly delayed start. We're just getting a few technical issues sorted out. And this evening, we will be dealing with the topic, the impact of climate change on the workplace and employment relationship. And we're looking at this in the context of the recent hurricane as well, Beryl, and also the emergency response capacity as an important resource towards averting a potential crisis. We are in the rainy season in Trinidad and Tobago. We are in the hurricane season. And we know, of course, there are lots of factors that have to be considered. So this evening, we have three distinguished panelists, and I will introduce them now at the start. First, just to indicate, I am Trevor Johnson from the Labor Studies Department here at the Cipriani College, and I will be your moderator for this evening's webinar. So let me go straight to introducing our panelists. We have the very distinguished Major General retired Rodney Smart, who is the Chief Executive Officer of the Office of Disaster Preparedness and Management, the ODPM. And this is the National Disaster Management Coordinating Agency for Trinidad and Tobago. In this position, he is responsible for developing the ODPM into a high-performance organization focused on strengthening Trinidad and Tobago's readiness and resilience against disaster and climate-related risk. Major General retired Smart is a former Chief of Defense Staff of the Trinidad and Tobago Defense Force. Prior to his appointment as the Chief of Defense Staff, he held various other strategic level positions within the Defense Force, including Commanding Officer of the Trinidad and Tobago Regiment and Director, Force Development, Strategy and Transformation. He also co-led the interagency task force established between the Defense Force and the Police Service. He has extensive knowledge and experience in military, security, and humanitarian operations. In the case of the latter, he participated in humanitarian assistance and disaster relief operations in Grenada and Jamaica, and represented this nation in peacekeeping operations in Haiti. Since assuming leadership at the ODPM, he was deployed overseas to Guyana to provide support to that country following the 2022 floods there. The retired Major General is the recipient of several awards and decorations, including the Public Service Medal Gold. He has studied extensively and holds various levels of certification, including a master's degree in strategy, a master's degree in military art and science, and a bachelor's degree in management studies. He's an inductee into the U.S. Army Hall of Fame and is a member of the Leadership and Management Institute. Major General retired Rodney Smart, we do welcome you to our panel and thank you for taking the time out to be with us this evening. Our second panelist, we have also very distinguished Ms. Avian Drayton Bailey. Avian is a registered nurse for over 20 years and also qualified as a psychiatric nurse with 5 years of experience. She is the former nurse manager of the cardiology unit at the Eric Williams Medical Sciences Complex. And she is presently also the first vice president of the Trinidad and Tobago National Nursing Association. She has varied hospital experiences and worked offshore for 3 years as a vessel registered nurse medic on various dive sea vessels. A proud alumnus of the San Fernando School of Nursing, her mantra is, "Be the change you want to see." She has coordinated various events at the North Central Regional Health Authority, Lions Club of Trinidad and Tobago, the Joint Trade Union Movement, and the Trinidad and Tobago National Nursing Association. She holds a professional certificate in events management from the Arthur Lockjack School of Business with an emphasis on corporate events. Ms. Drayton Bailey owns and manages Avian's events and catering services. She's also a part-time lecturer at the University of Trinidad and Tobago Introduction to Nursing Management program, and previously facilitated the Introduction to Events Management course at the University of the West Indies Open Campus. Ms. Drayton Bailey is a past president of the Success Laventille Lions Club and the immediate past chairman of the Northern Branch of the Trinidad and Tobago Nursing Association. She's currently a member of the Joint Trade Union Movement Leadership Council and the Region 4 Director of the Caribbean Nurses Organization, with responsibility for Barbados, Grenada, Guyana, St. Vincent and the Grenadines, Suriname, and Trinidad and Tobago. Ms. Drayton Bailey is on the air every Thursday on I-95.5, where she co-hosts the weekly nursing program, TTNNA Talks. Welcome, Mrs. Avian Drayton Bailey. Thank you for agreeing to be on our panel this evening. And finally, from right here at the Cipriani College of Labor and Cooperative Studies, we have our own Miss Janice Johnson Lord. And Miss Janice Johnson Lord basically is a lecturer attached to the Labor Studies Department and also facilitates specialized training on behalf of the college. She is certified as a trainer of trainers with the Pan American Development Foundation, and she holds an executive master's in business administration. She is the owner and director of Gerias Consultancy, whose mission is to, quote, build capacity for excellence. She aspires to be full with the intent and approach of dying empty. Mrs. Janice Johnson Lord is a past student herself of the Cipriani College of Labor and Cooperative Studies, and she is also a retired prisons officer. So welcome, Mrs. Johnson Lord. Welcome to all our panelists this evening. And in terms of the order of presentation, we will have Major General Retired Smart doing his presentation first. Then he would be followed by Miss Avian Drayton Bailey, and then Mrs. Johnson Lord. Each panelist will have approximately 10 minutes. We'll have a bit of latitude to make their presentation. I know some of you may wish to share a PowerPoint or otherwise. That is quite okay. And after you will all do your presentations, and then we will move into a time of question and answer. We do have, of course, an online audience, and they will be able to feed questions in, as well as questions that would be asked by myself as moderator. So basically, that is the approach we will adopt for the evening. And I would now like to get straight into the presentations and invite Major General Retired Rodney Smart to open us up with his presentation. Thank you.
Thank you very much, Mr. Moderator. And let me say thank you to the Cipriani College of Labor and Cooperative Studies for inviting the UDPM to be part of this evening's presentation. I'm just confirming that you're hearing me, everyone?
Yeah. Yes, we are.
Thank you. And let me take the opportunity to say thank you to my fellow panelists for me joining you this evening, in my esteemed panelists. Thanks very much for having me. And good evening to the viewing and listening audience. We'll start first. We're looking at the presentation outline. I will leave that for you to take a look at. Mr. Johnson has given me 10 minutes and my time is counting down. So I will leave it for you to take a look. Right, ODPM. Who are we? The ODPM is a strategic disaster management agency for Trinidad and Tobago. It was established in 2005 by the Cabinet, and our main purpose is to build national disaster risk management and climate change adaptation capabilities with our partners, and to coordinate response and recovery operations when necessary, and all in order to protect the people, the environment, and the economy, and to ensure a disaster resilient nation. To do that, we have quite a few principal functions. The first I have here is conducting disaster risk assessments, resupplying response agencies, and strengthening their capacity. So in Trinidad and Tobago, disaster management is done by a number of agencies in the public sector, the private sector, as well as civil society organizations. Responsible as well for collecting, storing, analyzing, and disseminating disaster risk information and knowledge management. So quite a lot of information is gathered from our partners, coordinating and distributing disaster relief in support of first response agencies. And these first response agencies are usually our disaster management units in the Ministry of Rural Development and Local Government, the Trinidad and Tobago Fire Service, and others. So we support them when they are unable to get disaster relief. We do strengthening of policies, mainstreaming disaster and climate risk, hazard tracking mapping, educating the public, and conducting community outreaches, and managing the ODPM's volunteer program. I will have skipped a few, and we will speak about them in a bit more detail as we go through the presentation. So the ODPM uses a strategic governance framework to do our work. And it is informed by the international, regional, and the national frameworks. And the driving force from the international is the Sendai Framework for Disaster Risk Reduction. Regionally is the Comprehensive Disaster Management Strategy, which comes under the Caribbean Disaster Emergency Management Agency. Of course, our National Development Strategy, Vision 2030, the Ministry of National Security Strategic Plan, because we are a division of the Ministry of National Security. So while today our focus is on hazards, on climate change, the ODPM has to take a multi-hazard approach to our work. And here in front of you, we have the hazards of greatest concerns, and we divide them into two generally, natural and man-made or anthropogenic. And these could be hydrometeorological, seismic, environmental, biological, you will remember the pandemic, societal, and industrial, technological. So the focus today is on climate change, and we would have been taken from the IPCC, the Intergovernmental Panel on Climate Change, their view of what it is. So it refers to a change in the state of the climate that can be identified by changes in the mean, the average, and or the variability of its properties, and that persists for an extended period of time, typically decades or longer. So generally, we're speaking not about short-term change in the weather conditions, but a long-term change in the climate that one could statistically recognize. And our main thing today is about Hurricane Beryl. And this definitely, by most of the pundits, have been considered to be the result of a change in our climate. The first time in several decades, we have seen a hurricane this early in the season. And the track that it took was a bit unusual. So there's a view that this is not the norm, and therefore Hurricane Beryl has been classified by most persons as being one of those climate challenges that we face. This diagram is to indicate that there are quite a number of hazards. While climate change is not a hazard itself, but there are quite a number of hazards and some hazards that are that climate change causes. And really some of those things that we experience is the extreme in the weather. We're seeing rising temperatures. We're seeing rising sea levels. We're seeing rising CO2 levels, as well as sea level rise. So there are quite a number of things, and by extension, the impact that it has on health. And when we speak about health, we immediately speak about our workplace. So some of the macro impacts of climate change that I would have just alluded to include as well impact on the labor market. And center and at the bottom of this diagram, we're speaking about all these things that are happening as a result of climate change and climate variability impacting the labor market, impacting our workforce. So some of the things that we are seeing as a result of climate change is reduced job security and employment opportunities. It could cause harsher working conditions. It could cause the industry structure and economic shifts. Changes in labor policies and worker rights could be challenged. Social and economic inequality, global and regional migration. And that is one of the things that we see. In fact, we would recall that there's this large movement of people from the east to the west because of the climate challenges that many countries are facing. This slide as well speaks to some of the challenges that has been recognized. 1.6 billion workers exposed to ultraviolet radiation, over 18,960 work-related deaths. Jump to the one down at the bottom on the left, up to 860,000 work-related deaths among outdoor workers because of the extreme heat. One of the working groups that are most threatened are those persons who work in the outdoors. So, Hurricane Beryl, we would remember, would have impacted Trinidad and Tobago first. And in our case, we had over 297 incidents, 75% occurring in Tobago. And this chart here was from information that the ODPM was able to gather throughout the country. 127 fallen trees, electricity poles, landslides, damage to houses, blown roofs, 104, blocked roads, and flooding events. 40 shelters had to be opened, and over 160 displaced persons were sheltered. For Trinidad and Tobago, as we know, while we had our challenges, we were nothing close to what Grenada, Haiti, Martinique, Carriacou, and Jamaica experienced. And these are some photos from an area flyover that the Trinidad and Tobago Air Guard did the morning after of Carriacou. So the national response to Hurricane Beryl in the case of Trinidad and Tobago, it resulted in the ODPM activating the emergency response structure. And this emergency response structure is mirrored by the National Disaster Prevention and Preparedness Multisectoral Committee, as well as the response agencies in Tobago, the Tobago Emergency Management Agencies, the DMUs, and all the others that are stated there. Trinidad and Tobago Defense Force is not considered a first responder, but the Defense Force would come in if greater capacity is needed to deal with the situation that is before us. Trinidad and Tobago would have assisted Grenada and St. Vincent by sending goods, and there would have been 4 vessel loads sent very early after the passage of the hurricane. And some of the things that we think that are important in terms of the arrangements that now one must take into consideration in the workplace because of the change in climate is things like business continuity, making sure it's front and center, flexible work arrangements, financial support and assistance, job security policies, employee assistance programs, ramping up of that, and training and skill development. From the ODPM perspective, we think that there needs to be a new culture in the workplace, a culture of collaboration, a culture of coordination, caring, communication, a co-creation of the workplace of the future, developing and revising that employee-employer charter, all parties being prepared for the organization survival. We see what would have happened in those islands, but we have to think about the survival of the organization and providing mechanisms for feedback and plan improvement. This slide speaks to some of the work that the ODPM is doing right now, but I'm mindful of my time, so I will save this slide. And I would, at this point, end and say thank you very much for your attention.
Thank you so very much for that very instructive and informative presentation, Major General Rodney Smart. We really do appreciate this, and we certainly look forward as we go on later this evening to the question and answer time to even get an expansion and further clarification on some of the areas that you would have mentioned, particularly interested in the number of deaths associated with climate change. So thank you so very much for your presentation. And I would now invite Ms. Avion Drayton Bailey to do her presentation. And then we move on. Ms. Drayton Bailey.
Hi, good afternoon, everyone. Can you all hear me?
Yes, we can.
Okay, excellent. Let me start to share my screen. Okay, are you seeing the screen?
Yes, we are. Yes, we are.
Okay. All right, so it's my pleasure to be here with my esteemed panelists today, and I am aware also of my time. So I would also try to go through very quickly with these slides. I did a background on climate change, and I focused on the anthropogenic, which is human-caused climate change, which is occurring because of harmful pollutants, overconsumption, and other human actions that emit millions of tons of greenhouse gases into our atmosphere each day. And that came from IPCC 2023. Now, these gases trap heat in the atmosphere, and over time, this has caused gradual but steady warming of Earth's average temperature, resulting in global warming, which is causing significant changes, many of which put human health at risk. In 2015, the Paris Agreement was established when the world's nations agreed to limit warming to 2.0 degrees Celsius, with efforts to keep it below 1.5 degrees, and that's from the United Nations 2015. As of 2023, scientists have reported that we are likely to surpass 1.5 degrees warming in the early 2030s or sooner. Now, there are several greenhouse gases that retain heat in our atmosphere, and the most common is carbon dioxide, and it is the biggest source of carbon dioxide pollution. It's the combustion of fossil fuels such as natural gas, gasoline, oil, propane, jet fuel, and diesel. Other greenhouse gases include methane, and healthcare commonly use anesthetic agents such as nitrous oxide and fluorinated gases. For the sake of convenience, scientists often convert all to carbon dioxide equivalent and refer to these greenhouse gases as carbon. So, because I'm into healthcare, my area focused more on health. And acute and chronic conditions can be worsened by extreme heat, wildfires and wildfire smoke, flooding, extreme storms, more intense allergens, and an increase in vector-borne diseases such as malaria and tick fevers. And we know right now we also have dengue and the increase here in Trinidad. Climate change also impacts on health. It impacts mental health with added stress, anxiety, and depression. Social stress can increase with intolerable weather events and destruction from storms and fires. And managing serious mental illness in vulnerable populations can be challenging during extreme events. The impacts on health. We note that mostly the vulnerable populations, including developing and marginalized nations like ourselves and the Caribbean, the very young, the elderly, people with chronic diseases, unhoused individuals, and in nations that are more developed, we have people of color, people living with poverty, the LGBTQ plus communities, and individuals and groups excluded from decision-making about important impacts on their lives are more likely to suffer the consequences. So these are some position statements by some health organizations. The first one is the World Health Organization, who recognizes climate change as the single biggest health threat facing humanity, and that was in 2021. The International Council of Nurses in 2018 stated that climate change presents the single largest threat to global development, with the potential to undermine the past 50 years of public health gains. So it could be eradicated just like that. And then the American Nurses Association recognizes that climate change is a critical public health issue that requires urgent action to mitigate its impact on human health and well-being. So the effects of climate change, of course, we know increased natural disasters. So there are extreme weather, hurricanes, earthquakes, tornadoes, floods, droughts, etc. We also have impacts to access to healthcare, closed roads, fallen trees, lack of transport. Healthcare professionals are either trapped on work or trapped at home. It disrupts the delivery of healthcare. There's interruptions to electricity internet, telephones. You are unable to access X-rays, CT scans, MRIs, ultrasounds, diagnostic testing of patients. And who's at risk? Well, before we said the elderly, children, pregnant women, persons with comorbidities and NCDs and non-communicable diseases. And you know, we would have had a recent rise in non-communicable diseases here in Trinidad and Tobago. And this includes cancer, diabetes, high blood pressure. What are the implications to our population? We can have poor air quality, which would have increased allergies for persons who are susceptible to same. There are damaged crops, so there's less available fresh fruits and vegetables. Therefore, poor nutritional intake and increased vulnerability to diseases. There's a contaminated freshwater supply and the risk for waterborne diseases such as cholera, and with the increase with mosquitoes and stuff, with dengue. So those were my basic information concerning healthcare and climate change. And I hope that you all were able to grasp something from that.
Thank you so very much, Avion. And we certainly were, and we do I think, appreciate the sharing from a healthcare perspective and helping us to understand some of the intricate issues and details that as a result of climate change, how climate change impacts the delivery of healthcare and the execution of healthcare, especially to the more vulnerable, categories of our population. So thank you so very much for that, and we certainly want to expand that discussion in the question and answer time. So let me invite our esteemed third panelist, Ms. Janice Johnson Lord, lecturer here at the Cipriani College, to bring a perspective regarding the issue of climate change and its impact on the workplace and the work-employment relationship, and so forth. So you are on, Ms. Janice Johnson Lord.
Good afternoon, and thank you, Mr. Johnson, for inviting me to this panel. Welcome to Major General. Thank you so much, and Ms. Avion. The good thing about going third or last, as it were, a lot of what I was about to cover have been covered by you, especially Major. I think you labor studies is your calling, because I see you mention a lot of work-related issues. And as a labor studies student and a past prisons officer having to work under certain conditions, I can certainly appreciate the impact of climate change, particularly as regards to the air quality and the uniforms that we're called upon to wear. However, I reference the UN definition of climate change because it stood out to me as a long-term shift in temperatures and weather patterns. And yes, we reference Beryl as our recent example in terms of weather patterns. But what also stood out is that it is attributed to human activity. So that tells me that we have some level of control over the way the climate behave. Interestingly enough, humans are held responsible for climate change, but the impact is felt and is severe on the humans themselves. And in this context, I'm talking about the employment relationship. Some of the issues that we see happening almost immediately because of the temperature, and I don't know if you all remember last year, the heat waves, where we were given warnings to stay indoors unless we really had to be outside. And of course, we have the essential services that must be outside. And therefore, we're looking at the employment relationship in terms of rights and responsibilities. The responsibility of the worker, the rights of the worker, the responsibility of management, and the rights of management. So we're looking at the impact, as it will, on humanity. Once we talk in human, we talk in employment relationship, we talk in humanness. Marine life affected, the domino effect of that, decreased oxygen content. So here we have plants and animals dying off. Automatically, we're talking about our food chain. If we talk in food chain, we're talking scarcity. If we talk in scarcity, we're talking price. If we talk in price, we're talking inflation. And that is going to dovetail back to the employment relationship in terms of negotiation. How do we collectively bargain to maintain the purchasing power of the dollar? How do we maintain a decent standard of work? We're talking about water scarcity, so crops going to be affected. Now we can see the price of perishables in the market. Yet we are held, and I'm not being political here, but we're held to 4% in 10 years. When inflation is eating away at the purchasing power of the dollar, Avian would have raised the issue of health and healthcare. We know what the public healthcare system is like. So the ability to provide for yourself in a private healthcare system. So we literally seen this climate change having a domino effect on almost every aspect of the worker's life. But we can't talk worker unless you talk management. So we're looking at the cost of doing business. Now your infrastructural design will have to be adjusted. So where you were using fans, now you're going to put in air conditioners. That cost of your infrastructural design is going to go somewhere. And more often than not, it's the consumer who also is the worker. So when you suffer from that oxygen level or deficiency in the oxygen level, you have person with asthma, asthmatics, you're talking now about a worker who has a health issue that is still required to be productive. So you're looking at absenteeism, whether through sick leave, stress-related illnesses, breathing problems. So even if they're on the job, they still cannot produce at the level you require them to produce for the organization to be successful or to achieve its mission. Or you have them away from work, possibly in the hospital, which are going to have to carry up the cost of healthcare, government expense, taxes increase. The employment relationship, therefore, going to speak to the affordability or the ability of the employer to pay or to respond to demands of the union for increase in pay. Flooding, which I think I left that for Major to deal with in terms of Beryl, but we saw what hurricanes and floods and storms can do in terms of survivability and the cost to restore. We would have seen in 2019 that flood that wiped a good bit of Trinidad and part of Tobago, right? A lot of persons still recovering from that. So we look at the impact of food prices, the ability of the family to take care of itself. So now what do? The employment relationship, we're saying is neither the workers' fault, the union's fault, the management's fault. What do? The need for consultation, the need for collaboration, the need to look at alternatives to increase wages, because we're still dealing with climate change in the context of structural adjustment. And we know the austerity measures we are facing, having to pay back debt as a country. What do? Flexibility, flexi time, employee assistance program, but all of these are cost items. Who is to bear the cost? These are questions we have to be able to answer as a people when we're looking at climate change. I paid attention to the Paris Agreement, and maybe I'm a conspiracy theorist, I don't know, but when I looked at the recommendation for funding, automatically structural adjustment came to mind. So I'm asking myself, what is the cost of the funding that will be advanced to developing countries to help us deal with climate change? I am saying that's for the long term. In the short term, let us look at what we can do as humans to minimize the impact of climate change and minimize the impact on the employment relationship. How can we treat with this aspect of absenteeism? We had a recent experience, and I raised it with my program dean. Schools were closed because of Beryl or that it was a storm or hurricane threat. That's an impact on the employment relationship because the children are now going to be home unsupervised. What do we have in place in terms of policy for the parent who now would be required to provide for the children who would not ordinarily be in school because they are running the risk of harm to the child in one instance or criminal charges because to have children home unsupervised is a charge of negligence. So we're seeing a whole cyclical problem taking place, and we say, where do we start? How do we look at the employment relationship so that both parties and country could benefit? We talk about sustainability, business continuity, but a parent who is on the job, concerned about their child that is at home, unsupervised, will not produce as much as or as well as the parent who has these things under control. How do we improve our public health facility knowing the risk of health to our nation or to our citizenry, as it were, because breathing problems are on the rise, asthma, bronchitis on the rise. And then you have the employer who is very rigid. You have X amount of sick leave that you can utilize for the year. That has been exhausted. So now we're talking about no pay. That's hitting the worker in the pocket through no fault of theirs. They've gone ill. But at the same time, it's not the employer's fault. Okay, so now we're looking at how do we partner? How do we go about coming together? So we're talking about that lovely Convention 144, where we get back to the table and consult. We, as working people, as leaders, we are incumbent with a responsibility to encourage parties to make concessions, right? Rigidity. You must come to work, but your children are at home unsupervised through no fault of yours nor theirs. The heat wave. So you must come out to work. There are situations and circumstances, COVID taught us this, where persons can work from home and in some instances be more productive than be in the workplace. So we've seen a call for more empathy, more flexibility in addressing this issue of climate change. All right? Organizations, management, government. So we'll have government policy. We look at the sustainable development goal. They're looking to ensure and protecting the planet and natural resources. How do we know our people? If we don't legislate, we're going to have problems on our hands. So we know we're looking at legislative reform in a number of areas and a number of issues where we have to make certain things mandatory. But I also want to emphasize on the need for retooling and reskilling working people. It's a whole cultural shift. It's a way of thinking. This is where we're at. What do we do to minimize the impact of weather conditions, heat waves, floods, natural disasters on our relationship one with the other? And how do we train the worker, and I'm putting this at the union as well, the worker to recognize if the organization is not successful, then our jobs are at risk. So the issue of job security is one that we also have to look at in terms of climate change. Climate change is, we recognize the global emergency, but we can't wait for the first world or the leaders to take us there. There are short-term things that we can do that we should look at as solutions. And I think it's time for management, work organization, government to sit and come up with a framework, even in the short term, to address the impact of climate change on the employment relationship. If it's flexi time, hours of work, minimize the amount of days work out of the home, work from home policies, health and safety issues. So this climate change is helping us to reshape and redefine, as it were, the employment relationship. Let's see it as an opportunity to show the first world that we can problem solve. We are developing our psyche, and we are solution oriented. And we can come up with ways to adapt to climate change and its impact. The services that we are in uniform, that is in itself generating heat. How do we look at that? Or do we stay with the old model of forcing persons to work in heated conditions, in heated material? These are some of the, and I call it low-hanging fruits, that we can look at to help alleviate the hardship on working people, and so contribute in some way, shape, or form to a decent standard of work in some areas. I don't know if that added to the discussion, but that's where I was in terms of having to veer away from where I was recognizing that the risk is not just for the planet, as it were. The risk is family life, socioeconomic issues, health issues. If your people are not healthy, your nation will not survive. And therefore, I am happy that we had somebody from Health on panel, because it's important for us to look at the impact of climate change on the health of your people so we can have a healthy workforce. Thank you so much for listening to me. I hope I didn't go over my time.
Thank you so very much, Ms. Janice Johnson-Lord, and you have certainly added certainly a lot of weight to the discussion that we're going to have. And I'm almost thinking I would have to speak to my head of department, because it looks as if we need to have a part 2 of this particular dialogue and discussion. And I hope I can come back to all of you panelists at the appropriate time in the not too distant future, because we are really talking sort of an existential threat when we deal with the issue of climate change. It's literally a life and death issue, as we would have seen from one of the slides that would have been put up by Major General Rodney Smart. And so I'm going to start with you, Major General, and just help us to understand a bit. As you know, you were speaking, of course, from the perspective of the ODPM, the Office of Disaster Management and Preparedness. And sometimes in disasters, you know, somebody's roof blows off, their house is flooded, their home, and you know, they're just not sure who to turn to. So they make a call. Maybe they get through to the ODPM, and then this issue of who is a first responder comes up. So I know you did sort of indicate for us, you know, the various agencies, but maybe if you could just clarify again, because you do hear from time to time people in a disaster, you know, things are a bit blurred, and they really want to know which agency of the state do we turn to for help. And this issue of first responder then becomes a bit blurred in their mind in a disaster. So Major General Smart, can you speak to that and in helping us clearly understand the role of the ODPM?
Thank you very much for the question, moderator. What the ODPM has been doing over the past few years is attempting, through conversations like these, through the development of videos, through interactions with the public, and through something that is known as the National Disaster Prevention and Preparedness Month, which is in May and strategically placed in May because it is the month before the commencement of the hurricane season, which starts on June the 1st, but also in the area of the start of the rainy season, which really has no start date. So through those mechanisms, and I hope you will have been seeing a number of videos on television and on social media, where the ODPM is educating the public about various things such as the public alert notification system, as well as the grab and go bag. But also in there is a video that speaks to what we call the national response framework or the national response approach. And through that mechanism, and here's where I'm going to answer the question directly, the ODPM illustrates that in the event our country resources, the first response agency resources become overwhelmed, and we use that word overwhelmed, expanded, stretched, then the ODPM gets involved from a response perspective. And I emphasize response because today, really, the question is asking us and has pointed us in the direction of response. But in addition to response, the ODPM is involved in the whole disaster management cycle. And we're speaking about from prevention, mitigation, preparedness, response, recovery, rehabilitation, reconstruction, etc. So from that perspective, the ODPM gets involved. But ahead of the ODPM and in line with the national response framework, the first response comes from either the disaster management units under the Ministry of Rural Development and Local Government or the Trinidad and Tobago Fire Service. And it's really what we call a local response. In the case of Tobago, it's the Tobago Emergency Management Agency. When they are incapable, because they have drained their resources, because the challenge is so great, then they will invite the ODPM to get involved. But the ODPM is not an organization with troops. It doesn't have several vehicles and heavy machinery. And that's where we get the national output, either from the Defense Force or we ask for greater support from the Fire Service. We call that level 2. So we move from level 1, we move from level 2. And quickly to end, at level 3, which again is one of the responsibilities of the ODPM, similar to what Grenada and St. Vincent is going through now. If the national resources are incapable, then we reach into the regional system, which the ODPM will do on Trinidad and Tobago's behalf. Hopefully we don't ever have to do that. But at level 3, we then ask for regional and international support. At this point in time, Trinidad and Tobago has Defense Force personnel and also ODPM personnel overseas in those islands. And soon I know TNTech will be deploying their personnel as well. I hope that helped.
Certainly. Thank you, Major General Smart, and yeah, I do appreciate the clarification for that. And I'd just like to quickly move over to Ms. Drayton Bailey. We do, in fact, and I should have mentioned it earlier, of course, we do have can field questions from our online audience as well. And this first comment / question was touched on a bit in one of the presentations, but the Ms. Drayton Bailey, in let's say your perspective from you are on the leadership of the joint trade union movement, and you're also the first vice president of the Trinidad and Tobago National Nursing Association. So from a labor perspective, this question coming from the audience is, have employers retained the adjustment / policies introduced during COVID, for example, flexible work arrangements, etc.? Or is there some like a reversion to the traditional, sort of control? So I think what the person is expressing is a concern that is there some sort of national conversation taking place between the various tripartite stakeholders, employers, worker representatives, and government with respect to the issue of climate change and the impact that it is having on the workplace? Are you aware, and can you share perspective on this?
Okay, I'm not aware that the healthcare system has employed any of their COVID measures now. At the end of COVID, everything reverted right back to how it was at the beginning. I do know that I would have heard the government is working on a work-at-home policy. But again, concerning healthcare workers who are considered essential staff, this will not be applicable to the regular worker who delivers care. I'm seeing more from an administrative point where maybe management may be allowed to work at home a few days a week or so forth, but the actual daily work processes needs the essential services to be outside. So there isn't anything like that. And remember, during COVID, healthcare workers were working. So they were never at home. And I remember this being an issue because I was a manager at the time in the system and living in Sipari and working at Eric Williams. And I remember being annoyed every day when I have to drive up the road when there were certain things I felt I could have done from home. But we have to also look at the regular nurse, patient attendant, hospital worker, kitchen staff, and so forth. Even though we consider healthcare services essential, not all of these categories of workers are considered essential. And let me just give you an example. There were, I can't remember, some years ago when we had the floods that would have shut off the highway and persons were unable to traverse the north, I think it's the southbound lane of the highway because it was submerged. And we would have had healthcare workers, especially in the north, who were trapped on work for days. Remember? So especially, I would say, Eric Williams and so forth, they have a lot of staff who work south of the Caroni Bridge. And many persons were either trapped at home or trapped on work. And we would have had nurses who had to stay 4 days on the job because they could not leave and they could not get relief. So we have to put things like that, in context and find out what is there available for them. Persons who worked in the kitchen, they are not considered essential. Some of them would have been living north and they would have left and gone home and so forth. And I remember that the head of the kitchen had to remain, and he was the only person who had to cook meals for both Eric Williams and Mount Opoments. And when you look at this, this conundrum as it is, remember some of the workers are at home. You have the government stating persons are not to leave due to crisis and so forth. But then you have other persons who are there who will now have to step up to ensure that things continue to manage and to run. Another thing is that the responsibility of the kitchen supervisor would be for the patients and not the staff. So we would have had issues where staff were unable to get meals, who didn't have some cricks hidden in their lockers. That was what they had to use for the few days because whatever stocks they had, they were trying to ensure that it wasn't depleted because they had to ensure that the patients were able to get meals 3 times a day. And the staff who would have stayed, nurses and so forth, would have worked, as I said, maybe for 4 days. They eventually got a system where who would have had time off to sleep, But what was their remuneration for this extra duty, this extra effort they would have had to make? What would have occurred with their children who were at home expecting that their parent would have been coming home this afternoon and instead was trapped in the workplace for days? Okay, so you have the parent, whether it's nurse or whichever healthcare worker, who is trapped on work, cannot reach to their family, worries, stress, don't know what's going on with their children. They are also stressed out because they can't get any meals. They have to survive and hope that the water goes down eventually so that they'll be able to go home. If I remember, they were using wreckers to transport vehicles to pass on the highway. right? So we have to also consider that. And for Tropical Storm Karen, some years gone by, I think that might have been 2018. I think the Major General would be able to correct me, when we had Tropical Storm Karen and we would have had that storm watch. But you have the entire country shutting down. Everyone has to stay home, but essential care workers have to come out to work. They have to ensure that their patients get treatment. And even though I know that the hospitals would have been trying to make arrangements for them to come out, there was no care for the healthcare worker when they arrived. I remember that. I remember cooking a pata pilau when they called me out to work. And that was that one pata pilau had to go around the hospital to give to the nurses who were on duty. It just so happened I have a catering company, so I happen to do that. But remember, places are closed. So even if the employer wanted to get meals for the staff, there is nothing available. He cannot call a caterer to bring meals out. So we have to look at all these basic functions, the day-to-day communication. When we have electricity poles and Wi-Fi down, no communication, most of the hospitals do not have. Long time used to have a TV or a radio in every ward. You don't see that again, right? Because it's considered increased cost and it's not a necessary factor. But during an emergency, where if there is electricity and you want to know what's going on in the country, you don't have a TV, you don't have a radio. You may have the TV and radio, but then there's no electricity. There's no phone communication. And the way the hospital system works, from the time there's no electricity, there is also no phone. Yeah? So if a nurse has to communicate, let's say with the manager, she has to leave and go to that area, for information to spread. So we really, really have to look at our response. We have now started with the hurricane season for 2024. And we need to put things in place for the workers, right? Because some places don't even have proper locker rooms for them to have a shower, if they are forced to stay on duty. Simple things, but major things during a crisis that would affect persons' anxiety levels and stress and their delivery of healthcare to the patient.
Thanks so very much, Avion, and we will certainly come back to you if time permits, and hopefully the next panel discussion we have will be in person so that we can have some of that pot of pilau that you spoke of. So we will invite you to the entire panel to come in and you commit to that for us, because you have made it very, very public what, part of your competence is, apart from, of course, being a healthcare worker. So thank you for that. Ms. Janice Johnson-Lord, you spoke about the structural adjustment, the Paris Agreement, etc. Because sometimes when we speak of climate change, you hear talk about, the issue of green spaces, green economy, and just transitions, etc. And we have had all these international, conferences. I think we have, 2 or 3 major ones in the last few years. Are we any closer to, let's Trinidad and Tobago, or, as a region per se, if we just limited to that from women, are we any closer to seeing something translated into like government policy, or as a, maybe, discussions between the tripartite stakeholders with regard to some of the issues that you would have raised in terms of, some of the adjustments that we need to make. So I'm just asking, from your perspective, are we seeing anything that has been established, any draft legislation at least, that would...
Not to my knowledge. I think we are way off. And if you remember, the union had walked away from that table because they felt the consultations were not meaningful, and therefore their input was not really considered. the extent to which we're back there, not back at the table talking now, I mean, that in itself is a question in the air. And therefore, before I could think region, I need to think country. It make me sound selfish. But looking, and as I said, using the very last example, there are little things we need to consider in problem solving for ourselves rather than wait for all these big conferences and big consultation and so on. There are simple things that we can do on our own and lead the way. We led the way with the response to COVID. Internationally, Trinidad was recognized with the way we handled it. So I see no reason for us to sit and wait to be led. All right. We have brilliant minds, brilliant people in our country that can submit drafts for consideration as a starting point in different areas. The college, Cipriani College, has one. Could draft. The unions, from their own perspective, could submit drafts for consideration and consultation. Where I'm at is still wondering what is being done, because we have not heard, or at least I have not heard, of any draft legislation that is seeking to address the needs of the citizen in regards to climate change. There's so many issues. Avian just raised some serious work-related issues there in terms of nurses having to stay over, all right, by necessity. But what was in place to recognize the contribution of the worker, the sacrifice of the family, the risk to the worker, because we know hours of work, ILO is still there, they haven't gone anywhere. And the workers' rights seem to be quarantined. I know we had a discussion at some time ago. The workers' rights seem to be quarantined because if I'm required to work 2 hours beyond my normal work hours, certain contingencies ought to be in place. And sometimes the unions go to the bargaining table only with percentage increase in mind, but there are other things that they can negotiate for the worker. All right, there are alternatives that can redound to the benefit of the worker. In such an instance, the collective bargaining agreement ought to say what is the right of the worker in that regard. Having stayed on work for X amount of hours beyond your normal shift, what is the requirement? What is the entitlement? What we're seeing happening here, and as I said, I probably take a little too left, is a repeat of all the systems of work. The workers' rights seem to be taking further, I don't say to the back seat, the furthest seat to the back, right? And I don't want to even get into the fixed term contract situation. So my answer is no. We have not seen consideration being given to those who toil to build our society. Because if we remove the human element from the workforce, as I keep saying, we can talk how much AI the computer cannot put itself on as yet. Even if it goes on without you putting it on, somebody's putting it on remotely. And therefore, we have to get serious and ensure that our leaders take us seriously in terms of putting frameworks in place. But I always say, rather than come with the problem, let's draft, let's make recommendation, send it forward, monitor to see where it's at, and see where we go from there.
Okay, thank you very much for that, and we certainly will develop on that as we go along. Major General Smart, I do have another question to raise with you, or to get a perspective from you, because you did speak a lot about so the aspects of looking at some of the changes within the workplace, for example, that we need to begin to look at. And I would suggest, yes, some of them were basically forward thinking, if I could say so. So basically, I just want you to help us understand from your perspective as the CEO of ODPM and being a professional in this whole area of managing disasters. We seem to be facing clear and present danger, climate change, hurricane season that is threatening to be one of the most active ever. What would be your priorities you would state for workplaces, the employers to begin to look at, and labor as well, if they were to be narrowed down to some critical issues that we need to look at now in 2024, not in dialogue in 2026 or somewhere beyond, but now that we need to look at that some tangible issues that we can address now, and some, maybe call it some low-hanging fruit. Major General Smart.
Thank you very much, Moderator. And before I respond, if you can just allow me to have a stab at the response that Mrs. Johnson-Lord would have alluded to.
Yes,
all right,
certainly.
so thanks very much. The ODPM, while the ODPM focus is on disaster risk reduction and management, in Trinidad and Tobago, the Ministry of Planning and Development is the focal point ministry for climate change. And I can indicate that recently, as in fact as late as May this year, the ministry would have submitted what is known as an Integrated National Adaptation Plan, INAP. And that plan speaks to some of the issues around how do we as a country, how should we adapt to the changing climate. So some of that discussion has begun. I cannot say if it's at the micro level in terms of the actual workplace, but yes, in terms of ours, from a societal perspective, those discussions have begun. And in fact, the ODPM is in discussion with the Ministry of Planning and Development with the whole idea of doing a joint disaster risk reduction and climate change plan. And I can also share that the ODPM, hopefully soon, through the same ministry, will be doing what we call an integrated disaster and climate risk study. And those kinds of things certainly are going to come out in this study. It's going to be a longitudinal study, and that is going to address all the major hazards and how they are impacting on our society, our people, our systems, our processes, etc. So some things are in the pipeline, and some things are being done. And probably a suggestion may be the next time we can invite the Ministry of Planning and Development to participate as well. That might be. To answer the direct question now, we would have alluded to some of the things, and we would have looked at some of the soft issues, and we spoke about co-creating the future. I think we are at a point where, given the challenges that we are facing, we have to change the dialogue in organizations. If we are to survive, if we are to thrive, the way that the employer-employee relationship is going to go forward must change. It has to change. And I think we would have thrown up that graphical image of what has happened to Carrier Cook. So just imagine for a moment that your organization has suffered this impact. So persons cannot go to work. There may not be a roof over the building. You have the problems, as my other panelists would have identified. Children having to go to school, but then there may not be any school. How are you as an employer going to bring this workforce to produce unless there's that relationship between the employer and the employee? So for us, a lot of it starts with those soft issues, and I think the words I would have used is about caring, about collaborating, about cooperating. Those soft issues become so important. In addition, the whole idea of how do you remodel your building? We went through a period of heat wave early this year, So because of the rain, we may have forgotten, but it was hot. And therefore, we now have to look at changing our style of buildings and probably not just bringing in air conditions, but how do you now pay attention to developing buildings that are able to give greater breathing? So the whole geoengineering has to change. So we're talking about the whole idea of if we want our workers to be productive, how do we change the actual structure? I think Mrs. Johnson Lord, a background in the prison service said, what about the uniforms that people working in, right? How are we expecting our workers to produce? So it is really that whole idea of this coming together of the minds, the organization minds, and thinking as we move our organization forward into the future. What are the structural differences we have to change? What are the policy differences we have to change? And what are those incentivizing our workers to be the whole part of this change, understanding that this organization is not mine, or it's not you versus me, but this is our organization. And for the organization to survive, we have to bring the best minds forward to produce these ideas because the environment has changed. Climate change has made us change. And if we are not to perish, and we would have heard recently about an island or just off Panama, where they're going to move everybody off. If we are not to perish, then we have to change the discourse. And I like the words of my panelists. We have to start leading and not waiting for people to tell us what to do. Not that we are that way, but we must start to really say, where must we take our organizations to? Thanks very much.
Okay, and just to any of the panelists, because I know we basically come into the end of the session, but either maybe Miss Bailey, Drayton Bailey, or Miss Janice Johnson Lord. Legislation, well, perhaps from the healthcare perspective, Avian, are you aware that there's any sort of, you spoke about some of the challenges that healthcare workers face, and you were very vivid in terms of your description of it. But at the level, let's bring it down the level of the TTNNA. Is there anything on the cards with respect to recommendations for legislative change or any type of recommendations to the Ministry of Health or government with respect to dealing with the clear and present danger of climate change?
Well, our second Vice President, Ms. Sharon Lacken-King, she is also on the ILO. I think it's 144 committee.
144, yes, committee,
yes. And they are working to get certain things done for the employees. We are still trying to get our recognized majority union status. And that has been an 8-year process with the RRCP board. So we are hoping that once we get our RMU, we would be able to sit with the employer and negotiate for better terms and conditions, as well as for policy changes for our membership.
Okay, thank you very much for that. And I think final question to you, Mrs. Johnson Lord, before we come to a wrap up. You started off speaking about human activity and human responsibility. And it speaks to us, perhaps what you might call developing a safety culture in Trinidad and Tobago, for us to become more conscious as individuals in our homes and also in our communities and our workplaces. Are you seeing any push in that direction or any change in the level of consciousness, collective consciousness of our society as a result of the imminent threats posed by climate change?
Not at a national level. You're seeing things happening in little pockets. You know, some communities where you have some level of skilled person, knowledgeable persons would benefit from that. For instance, where Major General community would expect some level of knowledge will trickle through his community. And therefore, what you will find is that different communities will operate differently because of access to information. What we really need to see is a nationwide sensitization taking place because our people perish for lack of knowledge, and a number of persons do things to harm the environment without being fully aware, conscious, and mindful of what that does. For instance, you walk through the streets after the rain passes, and the amount of plastics that you see at the side of the road. Even the persons who get the contract to clean the roadway or clean the drains, they put it up on the streets. Rain comes, washes it back down into the waterway. So I'm thinking what we really need to do at the institutional levels, national level, even from the home, is to really start a drive of sensitizing persons as to how they can help, how they can contribute to alleviating some of the impacts of climate change. All right. Littering. I am one that says they need to increase the penalty for littering because there's a domino effect, right? The person who throws the bottle in the waterway, they are not stopping to think about the consequence, the entire impact of that. So when somebody gets flooded out, draining government resources, government generates revenue through taxes, and yet when things go up, we complain, but we cannot identify how we contribute to the expense that government is tasked with taking on. And therefore, if we start to educate and have these conversations like Major General, change the narrative, change the conversations, have it at your dinner table, have it in the schools, have it at every level. Don't just put it at the feet of government or the ministers. Of course, they have their role to play. Even the trade unionists, what's the role of the associations and the trade unions in educating the workers or educating their members, as it were? How are we utilizing media, social and otherwise, to encourage persons to find out a bit more of what can you do? Our college, how can we promote this information so that persons will know, listen, this is what it is, but it can be reversed because if we did it, then we can undo it to some measure. And I think if we take it from that perspective, we will be leading the way in terms of bringing about some relief on our people in our space.
Thank you very much. So we now come to the stage where we want to just invite each panelist to do like a maybe 2-3 minute wrap up, sort of your closing remarks. So I would now invite Major General Smart, if you, any key aspect you'd like to focus on in your closing remarks or recommendations, I invite you to do so.
Thank you very much. First, I want to commend your campus for what it is doing. I think this is critical that the academia sees its role in terms of promoting climate resilience, climate change adaptation. So I want to commend you all for what you're doing. I also want to say that the university, and I'm speaking from the university perspective, in the same way how we are saying that the employer-employee relationship has to change, I am also encouraging your campus to also join with the other campuses, that the division that exists, and not that there is a big division. I'm saying that we need to move even closer because your role is so pivotal to the education that has to go through our nation that we would have just heard Mrs. Johnson Lord indicate. So we have to start building bridges if we are to see that change taking place. That education of the population becomes pivotal. As I said, what the ODPM is trying to do from a disaster risk reduction perspective is do the videos, do the social media, do the outreaches. But we recognize that education is so important. And taking the message to the population is even more important because there are people who sometimes they really don't know. They really don't know. Even many times you wonder, how could you not know? So the ODPM position is that we live in this space and it is up to us to make sure that this space is protected while understanding we are a fairly capable society and we have to remember our neighbors as well, who may not as be capable as us. Because if they go down, we by extension will also go down. Thank you very much.
Thank you so very much, Major General Smart, for that perspective. Of course, as a CEO of the ODPM, and we certainly would want to pursue and encourage this discussion and also pursue the recommendations that you would have made. So let me invite and perhaps acknowledge for the first time in this presentation as my colleague and comrade Avian Drayton Bailey to just give us some closing perspectives.
Thank you so much, Comrade Trevor. I just want to say that we need to remember that our health is our wealth. And in any major disaster, we have to focus on the healthcare needs of the citizenry, as well as those persons who deliver healthcare. We cannot do it without healthcare workers. As we said before, Trinidad and Tobago has a chronic problem with non-communicable diseases. And this means that a lot of our population are at risk for death within a disaster. If they cannot access to get their medication, if they cannot go to the clinics, if they cannot get wound care and so forth, if there is no electricity, we spoke about the heat waves and allergies and so forth. We also have to look at those workers, whether healthcare or not, who are considered essential, who, when placed with this major responsibility of attending to the needs of persons who cannot help themselves. After the disaster, do we consider stress leave for these workers? Do we consider additional remuneration for them for the extra work they would have had to do with it? Because as Ms. Lord had stated, the economy is, at such that persons really cannot afford certain things. So no matter what, people look at income. And so persons who are forced to go out to work within an emergency, what is in place for them after the emergency, after they would have given their all within the period? Do we provide them with anything, any sort of, counseling, because persons would have seen extra debts, things they've not been exposed to before. So we have to consider persons' mental health as well as their regular health. We also have to consider childcare services within our organizations, because we made many references to schools being closed, and it's very uncomfortable for some parents to leave their children at home alone. It's also illegal if they are underage. So is it that the workplaces will consider allowing parents to bring their children into the workspace? Persons who would have left their child at home thinking that they were coming home that same evening and then forced to remain on the job for 4 days. If the roads are impassable, accessible, that may mean that relatives cannot even access those children who might have been home or so forth. So we really have to look at the regular man on we can put in place to help it's all placed into consideration.
Yes, thank you very much, Comrade Avion, for that perspective and very, very strong focus. And it's very critical on the healthcare perspective because natural disasters certainly do have a way of exacerbating the challenges that those who are vulnerable in terms of health issues that they would face in terms of even them being able to access or get access to go to health facilities, etc., with flooded areas and that sort of thing. So this is a very, very, very critical thing, and there certainly needs to be some national dialogue, urgent national dialogue on this. So let me invite Ms. Janice Johnson-Lord from right here at the college, Cipriani College of Labor and Cooperative Studies, to give her final perspectives on this issue for this evening.
My perspective is, to me, is simple. We are all stakeholders in this fight against the impact of climate change. We all have to come up with solutions going forward and not just depend on government to do it for us. My admonition is to the trade union movement that seem to be very divided, some instances of necessity, to come together and discuss the way forward, make recommendation, put it in a document, whatever you want to call it, and send it forward as a starting point to dealing with the effects of climate change. Because climate change, while we say government, just remember those are persons too who are also affected and impacted. They might be able to mitigate its effects a little better than the average working person. But we have to look at how do we approach the issue as opposed to just sitting back and waiting to be guided. Make recommendations, proffer solutions, engage in sensitization. Sometimes the workers themselves will come up with a solution, right? Workers are very creative. As a matter of fact, if you do the history of dental floss, you know that came out from a worker on the floor, on the shop floor, right? And therefore, I'm saying we have to get to the point where we look to introduce different systems of work that has ingrained some level of flexibility and consideration for circumstances and situations, but we must also hold parties accountable for their part of contributing to solutions. At the end of the day, I agree with Avian, your people, health is the wealth of your nation. And therefore, whatever we do, for me, the most fundamental impact of climate change is on your health system. Healthcare, let's advocate for an improved healthcare system, even if we have to introduce online consultation with doctors as opposed to having persons crowded in a heated waiting room with broken air condition to see a doctor who may pop in for 2 or 3 hours because they have their own stuff going on and so on. Let's look at how we can take some of the pressure off of the system. There's some consultation that can be done online, and therefore persons move only when they have to. Let's borrow the model that succeeded in the time of the pandemic, where persons only move when they absolutely had to. That we can minimize the risk. Jobs that can be done adequately and sufficiently remotely, let's look at remote work, where we can look at digitalization and digitization as a part of the contributor to success. Let's look at that as well. But at the end of the day, let's look at building a nation that is resilient, that could bounce back from any untoward situation. And I think our people generally are very resilient, but I think we need to educate them a bit more, make information more readily available. And I agree with Commander, with Major General, the college must play a pivotal role in really activating these type of discussions across academia, across tertiary institutions, even if it has to come across any form of debate to come up with solutions. But let us see what best we can do to add to the solution. And in terms of workers and workers' rights, let's advocate for working conditions to be better, because we will only benefit from that as a society. Thank you so much for having me.
Thank you so very much, Ms. Janice Johnson-Lord, lecturer here at the Cipriani College of Labor and Cooperative Studies, for those closing remarks and your perspectives. Thank you also to Major General retired Rodney Smart, Chief Executive Officer of the ODPM, for taking the time at this critical juncture, because of course we know this is the rainy season. It is also the hurricane season. So we do thank you for taking the time, for agreeing to be on the panel, and of course to share your insights with us, which we found to be, very, very helpful. And we look forward to engaging you further on this. Thank you also to Comrade Avian Drayton Bailey, also for your sharing with us, especially in your capacity as a healthcare professional, but also that of the first vice president of the Trinidad and Tobago National Nursing Association, and of course as a member of the Leadership Council of the Joint Trade Union Movement, and thus bringing a labor perspective as well to these discussions. I just want to indicate to all that of Cipriani would have already begun to do its part, Cipriani College, because we are just in the closing stages of some research we have done throughout the Caribbean area, which started last year, towards at least 15 or 16 territories in the Caribbean, looking at the whole. One of the key features of that research was looking at the impact of climate change and of disruptions such as weather disruptions, hurricanes, etc. The issue of disruptions like the COVID-19 pandemic on especially small island states, and hopefully that research would find its way through the appropriate channels in the not too distant future. So I just wanted to mention that, and also to indicate that from the head of department of Cipriani, head of Labor Studies Department, Mr. Ian Daniel, he has sent me a message to communicate to you, indicating the commitment to continuing the conversation, as Major General retired Rodney Smart would have indicated. From the academia perspective, certainly we have a responsibility and a role in practicalizing some of these discussions, and also to engage our stakeholders as we go forward. So we are certainly committed to doing that as well. So I do want to thank all of the persons who would have been online, would have been participated, and of course to the support staff here who would have stayed to support this particular initiative. We do thank you, and we do look forward to hosting hopefully a part 2 of this, when we will be able to certainly go much further, because we know all of the panelists would have had additional material that they would have liked to share. But we do have a time limit which has reached. So thank you everyone for your participation, and do have a pleasant evening. Thank you to all the listeners and viewers from here at the Cipriani College of Labor and Cooperative Studies. Good evening.
Good evening.
Good evening.